Hello, I'm Dr. Adam Stout from Cloverleaf Animal Hospital here in Lodi, Ohio. And today I want to talk to you a little bit about spaying and neutering and the difference between each.
All right, so what is the difference between dog spaying and neutering?
Dog spaying is the surgical procedure of removing the reproductive organs of the female. The neutering is removing the reproductive organs of the male.
Then how does dog spaying or neutering impact the health and well-being of my pet?
It can prevent a lot of problems down the road. One of the biggest things is, unwanted pregnancies. And a lot of people say, well, maybe I just worry about the female. Well, it takes two to tango. So we always recommend spaying the female and getting your males neutered. There may be some behavioral issues that are arising. So not a guarantee that these procedures will fix that, but we do see some behavioral issues that, if we have them spayed or neutered, may address those situations.
How soon should I bring my pet in to see a veterinarian to get my dog spayed or neutered?
Well, as puppies, we're going to talk to you right off the bat as far as their health plan or program. When we first see them, 6 to 8 weeks is when we usually recommend seeing those puppies and getting them started on their health plan. And we're going to talk then about spaying and neutering. Now, an older dog, we're going to talk to you as soon as you get them. If that dog is not spayed or not neutered, as soon as you obtain that dog, give us, contact us here at Cloverleaf Animal Hospital, set up that first physical exam, and we can get that plan started on getting that animal spayed or neutered.
Okay. And what are some possible conditions that can be helped by spaying or neutering my dog?
Well, once again, probably the first one is pregnancy. There's so many pets that end up in shelters. It's a huge thing, like I said, to do both, responsible pet owner to do, the spaying and the neutering to cut down on the overpopulation. Females can run into a situation called a pyometrics, an infected uterus. Usually happens when they're older, but can happen at any time, and it can be an emergency. The uterus reproductive tract gets infected and really makes them sick, needs to come out. On the male side, a lot of what we see is prostate problems. Dogs have a prostate, and a lot of times intact males can have issues related to that prostate. So it's key to get them neutered.
And how will spaying or neutering affect my dog in the future?
It really shouldn't harm them as far as their lifestyle or their long-term happiness or healthiness. Like I said, maybe some behavioral issues that may be unwanted in the beginning, we may fix that. That's not always a guarantee, but it's one of the things when we see them on physical exam, if we see that they're having behavioral issues, part of that might be say, hey, we need to get this animal spayed, we need to get this dog neutered. As far as a lifelong, you're preventing a lot of problems, with getting them fixed. As far as their general health, there's really no consequences and doing these at the right time.
Okay. And what will my veterinarian need to know about my dog before spaying or neutering?
Well, what we need to know, or what we need to do, is we need to see them. We need to get them in here to the hospital here at Cloverleaf, get a good physical exam, and get them started on the plan of when this is going to happen, how this is going to happen. A lot of the costs and medications are based on weight. So we need to make sure we have that weight. We have a good, healthy pet that we're going to put on the table for surgery. So we need to make sure that they're healthy in the first place.
Okay, and then how long will it take for my dog to recover from being spayed or neutered?
We tell people here at Cloverleaf Animal Hospital that it's a 14-day recovery. The skin incision and all that takes about 14 days to heal up.
And then last question, what care should I be prepared to provide at home while my dog is recovering from their spay or neuter surgery?
Well, the nice thing here at Cloverleaf Animal Hospital, one of the technicians, once the surgery is done, they get a go home. We have a printed, filled out go home instructions for owners to have as a guideline at home on what to do and what to watch for. These are surgeries, so they're going to have to be somewhat calmed, no running, no jumping. It's 14 days to heal, and make sure everything heals right. So there's a nice go home instruction sheet that we have here at Cloverleaf Animal Hospital when they go home.
Okay. And then if there's any more questions regarding my dog getting spayed or neutered, what should I do?
Once again, I would say contact us here at Cloverleaf. Either email us, call us, set up an appointment, get a hold of us. We, once that first initial exam is set up, we'll talk about everything that needs done prior to the surgery. We'll talk about the surgery. But the main goal is to get them in here and let us take a look at them, see what's going on, and get that plan rolling.